Free NCLEX RN practice test with answers. Question 1. Set 1. What is the golden hour in newborn care? The first hour after birth for skin-to-skin and bonding, the first hour of active labor, the first hour of the second stage, the hour before discharge. The first hour after birth is critical for bonding and initiating breastfeeding. Question 2. Set 2. A patient is hearing voices that say, "Kill yourself." What should the nurse ask first? How long have you heard these voices? Do you have a plan to carry this out? Why do you think the voices say that? Would you like some medication? Assessing for safety and a specific suicide plan is the priority when a patient reports command hallucinations. Question 3. Set 3. A pregnant woman is at 32 weeks gestation. Which sign should she report immediately? Leg cramps, blurred vision or headache, backache, frequent urination. Blurred vision and headaches are signs of preeclampsia. Question 4. Set 4. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring. Question 5. Set 5. What does alopecia mean? Loss of appetite, loss of hair, loss of hearing, loss of skin pigmentation. Alopecia is the medical term for hair loss. Question 6. Set 6. Which is a characteristic of croup? Productive cough, barking, seal-like cough, wheezing on expiration, high fever. Croup is characterized by a distinctive barking cough caused by laryngeal edema. Question 7. Set 7. A patient with DKA has Kussmaul respirations. What is the physiological reason for this? To retain oxygen, to blow off CO2 and correct metabolic acidosis, to decrease blood pressure, to increase intracranial pressure. Kussmaul respirations are deep and rapid to compensate for acidosis by removing CO2. Question 8. Set 8. A child is admitted with tetralogy of Fallot. Which position helps during a TET spell? Supine, knee chest position, prone, side lying. Knee chest position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 9. Set 9. A client is diagnosed with peripheral arterial disease, PAD. Which symptom should the nurse expect? Dependent rubor, painless ulcers, bilateral edema, warm skin. Dependent rubor, redness when legs are down, is a common sign of PAD. Question 10. Set 10. Which electrolyte imbalance is associated with Trousseau sign? Hyperkalemia, hypocalcemia, hyponatremia, hypermagnesemia. Trousseau's and Klosteck's signs indicate hypocalcemia. Question 11. Set 11. A patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 12. Set 12. A patient with COPD is receiving oxygen. Why should the nurse maintain the flow rate at 1 to 2 L/min? To prevent oxygen toxicity, to avoid suppressing the hypoxic drive, to prevent dry mucous membranes, to save cost. Patients with chronic hypercapnia rely on low oxygen levels to stimulate breathing. Question 13. Set 13. What is the primary purpose of pursed lip breathing? To increase heart rate, to keep airways open longer and promote CO2 excretion, to decrease oxygen consumption, to strengthen the diaphragm. Pursed lip breathing prevents airway collapse during expiration. Question 14. Set 14. A patient with cirrhosis has an elevated ammonia level. Which medication should the nurse expect to administer? Lactulose, furosemide, spironolactone, propranolol. Lactulose promotes the excretion of ammonia through the stool. Question 15. Set 15. A nurse is caring for a patient with neutropenia. What should be avoided? Hand washing, fresh flowers and raw fruits, wearing a mask, high-calorie foods. Fresh flowers and raw produce can harbor bacteria and fungi, posing a risk to immunocompromised patients. Question 16. Set 16. A mother is Rh negative and her baby is Rh positive. When should she receive RhoGAM? At 28 weeks and within 72 hours of delivery. Only at delivery. Only if she has a second child. At every prenatal visit. RhoGAM is given to prevent isoimmunization in Rh negative mothers. Question 17. Set 17. What is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 18. Set 18. What are the 3 P's of diabetes mellitus? Pain, pallor, pulselessness, polyuria, polydipsia, polyphagia, poverty, pollution, population, pressure, paresthesia, paralysis. Excessive urination, thirst, and hunger are classic signs of hyperglycemia. Question 19. Set 19. Which type of immunity is gained after receiving a vaccine? Natural active, artificial active, natural passive, artificial passive. Artificial active immunity results from vaccination. Question 20. Set 20. Which medication is used to treat a suspected opioid overdose? Naloxone, flumazenol, atropine, epinephrine. Naloxone, Narcan, is an opioid antagonist.